The XCollar is an evidence-based cervical splinting system developed thanks to years of research and feedback from EMS providers. Thanks to them, the new XCollar is a life-saving device with advanced airway and cervical spine stabilization capabilities. When using the new XCollar, always follow your local protocols and have a second rescuer hold manual C-spine. It is important to perform the manipulative portion of the training as a team. The second rescuer can assist with the splint's application by holding the device in position, removing clothing, hair, and jewelry, while performing patient stabilization. The new XCollar. The XCollar is an emergency cervical and airway stabilization device. It is a splinting system that secures the cervical spine above C1 and below C7, posterior and anterior. In the package of the new XCollar Plus, you will find the XCollar. Numbered straps allow for easy application. The safety straps, used for obtaining the highest level of cervical and airway stabilization, and also for securing the patient to carrying equipment. These attach to the anchor points on the side of the XCollar. The XCollar tube holder features bilateral suctioning access, bite block and spikes for holding adult and pediatric tube sizes, and is secured to the collar with a safety strap. The backboard pad is used for stabilizing patients on backboards. For hospital and in-field use, we have developed the largest possible access to the cervical spine, providing doctors with complete access for patient assessment without removing the XCollar or removing stabilization. Applying the XCollar is a two-phase process: placement and secure. Slide the XCollar to its longest position and extend the back support. Phase 1. Placement. Slide the collar under the patient. Gently shimmy the back support into position. Encircle the patient and hook in place. Extend the chest support so that it rests on the upper sternum and the padding is level with the clavicles. Phase 2. Secure. Adjust the straps in numbered order to secure the patient, starting with strap number 1 to the corresponding number 1 and holding in place. Then adjust both number 2 side straps using opposing forces while controlling C-spine with one hand. Then attach both number 3 side straps. To obtain the highest level of patient safety, attach the safety strap to the anchor point on the cheek area. Loop the strap around the XCollar and attach to the anchor point on the other side, removing any slack. The patient is securely splinted with the new XCollar. For patient comfort, you can adjust chin strap. Airway Management. For airway management, use the tube holder and one safety strap. Attach one end of the strap to the tube holder and slide the other end through the anchor point. Place the tube holder around the airway tube and slide the bite block into the patient's mouth. Loop the strap around the splint and through the anchor point on the other side. Attach strap to the tube holder. Pinch the tube holder around the ET tube and wrap adhesive tape around the tube holder, working your way up to the ET tube. The XCollar tube holder secures to the splint and not the patient, avoiding blockage of venous return and optimizing oxygen delivery, thus increasing chances for patient full recovery post-cardiac arrest. The tube holder leaves access for suctioning both sides of the patient's mouth. For extra small and extra large patients, it is necessary to adjust the XCollar chin strap prior to the application. For extra small patients, remove slack from the chin strap. For extra large patients, add extra room on the chin strap. Extra slack can be removed after application if necessary. In position application, the XCollar is unique in its ability to splint a patient in the position found, avoiding manipulation. Application differs from the neutral position in that the collar is tightened on the short side first. Encircle the patient and hook in place. Extend the chest support so that it rests on the upper sternum and lock in place. Notice that one side may extend further than the other. Attach strap number 1 to the corresponding number 1 spot. Adjust side straps 2 and 3 on the short side first, while holding C-spine and using opposing forces. Then adjust both side straps 2 and 3 on the long side, using opposing forces. You have just secured the patient in the position of comfort. Securing to a backboard. For securing a patient to a backboard, use the head restraint system. Slide the backboard pad under the patient. Tear off extra padding and stack as needed for proper occipital support. Then pull the clear film tab to secure. Attach the safety strap to the XCollar anchor point. Then, loop the strap around the backboard as necessary to remove slack before fastening. Repeat on the opposite side. Unlike conventional head immobilizers, the XCollar head restraint system secures the splint to the backboard, allowing inline movement of the head with the body. This avoids hyperextension of the patient's cervical spine during transport. Removal. Removing the XCollar is simple. Just detach Velcro strap number 1 and disconnect the side hooks. Reset. To reset the new XCollar to its original settings, we extend straps to their longest setting and contract plastic to its smallest setting. Extend straps 2 and 3 on both sides. Then pull the chin strap tight and refasten about 1 inch from the other side. To retract the chest support, lift the locking tabs and slide to its shortest setting. To retract the back support, pull the collar on both sides of the back support and slide up to its shortest setting. And finally, fold strap 1 onto itself. and into the holding hooks.